Hey, good morning, Steve Jorgensen. It is June 25th. I'm here with Dr. Doug Smith, our Chief Medical Officer. Good morning.
Good morning, sir.
We are actually in supply chain where we keep all the supplies and wanted to share some great news about some of our PPE policies that are going into place. It's about a year ago that we had the state come in, do an evaluation of our practice and help us implement new practices regarding the proper use of PPE. One of those practices dealt with eye protection, where we really implemented eye protection in place pretty much across the entire practices. As we've seen, the vaccination rates continue to climb in Androscoggin County. We've seen the decline in COVID. Dr. Smith's been working closely with the state and with our covenant leadership to address some of these questions. And Doug, you have some great news.
I do, Steve, thank you. Yeah, very exciting that we can announce that we no longer have to wear eye protection in all patient interactions. So, exactly, I could jump up and down if I could. It's very exciting that we will still need to wear it in those settings where we call standard precautions, if there's splash worries, if you're taking care of a COVID positive patient, but situations where we have had to wear anytime with the patient and those things, that is no longer the case. So our screeners, our registrants, our PSRs in the practices, if you're taking care of people in the hospital that are not COVID positive or under investigation, you do not have to wear eye protection. Steve, we mentioned before that in mixed units we still need to wear full PPE unless we can completely separate the patients and the staff in that way. But yeah, don't throw them away. Hang on to them. We might need them again someday. But very excited that we don't have to wear eye protection all the time now.
Great news. So it's the registrants, the screeners, staff up on the floors in the work areas, they don't need to wear that.
Correct.
But in those situations where you have the standard precautions, which would include COVID and PUI,
Yep.
that's where we need to go with the eye protection.
Absolutely.
Don't throw them away. We may need them, we hope we don't. But I would also just say thank you for everyone over this last year. We know they've been difficult to deal with at times. You've found ways to make it work, and you've kept our patients and our staff safe. And just so pleased to be able to announce that right now that we're going to be moving away from having required eye protection immediately. Information is going out to your managers or newsletters, but this is just another way to communicate and for us to say thank you. And on a parting note, I would ask that we consider, and really if you haven't gotten a vaccination yet, please consider getting that vaccination. You maybe saw in the Sun Journal this morning that in Androscoggin County, the two healthcare providers are some of the lowest in the states for having their workers vaccinated. It really reflects what's happening in Androscoggin, but we can be better than that. We really want to encourage our staff to get that vaccination. If you have questions on how to get it, just reach out to your manager. We can find a way to get that vaccination to you. It's an important step in order to help keep us as safe as possible. Got any?
I don't. Just very exciting news. Hopefully we'll have a little more news that as the world changes and we get back to some sort of normal again. But yeah, just very, very exciting. I'm happy to share it.
Okay. Thank you for all you're doing. Have a great day.